Hello, my name is Nina McKay, and I am a nursing student at the University of South Alabama, and today I will be performing my wet to dry dressing check off. I will begin by checking the orders as well as the hospital policy, and I will go in and wash my hands and gather my items being a dressing change tray, sterile gloves, clean gloves, saline solution, and goggles. Next, I will go in and confirm my patient. Today we have here Mr. Jaguar Jones. On his bracelet it says Jaguar Jones, and his date of birth is also similar. August 25th, 1963. His allergy band says penicillin, and he also has penicillin on his chart. I will go in and I will perform an antiseptic hand rub, and I will also close the curtain for privacy. I will now move the trash can closer to me to allow me to do my procedure without any faults. I will go on and I will wash my hands once more because I have come in contact with my trash can. And next I will raise my patient's bed. I'm also aware that my table is pretty low for a hospital changing area, but this is what I have to work with, so I just want to let you all know. I will also lower the bed rails and position my patient comfortably. Next, I will be donning my clean gloves and my goggles. And next, I will be assessing the patient's wound. I will be removing the tape. And I will be assessing the type of wound. I will be assessing the amount. I will be also assessing the color, the consistency, and if there is an odor. I will also be assessing the size of the wound. I will also be looking at the granulation as well as the slop and the necrotic tissue. I will also go in and I will check out if there is any odor or anything. I will also palpate around the wound to see if there is any edema, redness, or tenderness as noted by my patient. I'll go in and remove my gloves. And discard them. I will be performing an antiseptic hand rub before I go on with my procedure. Next, I will be assessing I'll be obtaining my sterile field, noting the 1-inch border that I have set for myself. While noting the 1-inch border, I will be pouring out the contents of the 9th of the tray. I will next go in and I will look at my saline solution to see if it is expired or not, and it is not, so I will go in and pour it. Next, I will go in and I will don my sterile gloves, making sure that I acknowledge the 1-inch border on this as well. I will begin first by donning my dominant hand, making sure that I pay attention to how I put my gloves on, making sure that I am skin to skin and glove to glove. I will make sure that I use 2 fingers to don my non-dominant hand as well as my hitchhiker's thumb. Now I will go in and I will place my papers and gauze into my saline solution. Now that I have done that, I will address the suture line, stating that it is, stating whether it has drainage or if it is still intact or anything. I will go in and I will clean the suture line, squeezing out the excess saline, going down the middle of the suture line because it is the cleanest. And I'm going to drop that in the trash. I will go down the right side next, again, squeezing out any excess saline. I'll also throw that in the garbage as well. And next, I will go down the left side as I did the right. And next, I will go in and I will dry the suture line. And I will throw this away as well. Next, I will go in and I will fluff my gauze. And I will put them inside of the wound itself, as well as the other one. Is out the excess. And place it inside. And next I will go in and I will cover the wound itself. And I will use the baby pad. Next, I will remove my sterile gloves. Throw these away as well. And I will now grab my tape. also note the size that I will need it to be. If I can get it to open. Okay. I will measure it. And I will place it on there. I'll also do it for each side. And now for the last side. In a hospital setting, I would actually go in and I would write my name, the time, and the date that I placed my tape and everything. So anyone that comes in behind me or after I came in and did his dressing, they will know when, what time, and who placed the dressing on this patient. Today I assessed the patient's wound and I noted the type of drainage, the amount, the color, the consistency, and the odor. I also noted if there was an odor inside the wound. I also noted if there was any slop or granulation or necrotic tissue. I also noted if there was an odor inside the wound as well. I palpated the wound to see if there was any swelling, redness, or if there was any tenderness noted by my patients. I also noted that the suture line was intact. I will now be cleaning up my area, and afterwards I will go in and wash my hands. During this procedure, the patient's tolerance level was well.